There are more than 40 million people in Kenya, and the population keeps rising. The average family has 5 children, and while that number is down from 2 decades ago, the exploding population is outpacing the provision of resources and services, which are already stretched thin. Anne Okwisa is a mother of 4 living in Nairobi's Kibera settlement, one of the poorest areas of the country. She is discussing her birth control options with a clinician because she does not think she can afford to have any more.
I feel that the cost of living has gone up, and the number of children that I have are the ones I am able to take care of. If I give birth to more children, I don't have that kind of job which I can say will make me meet the needs of more children, and that's why I've decided to use family planning so that I can take care of my children.
Seeing the economic advantage of family planning, the government and NGOs help clinics like these so patients can access contraception cheaply. Walter Adoli says his clinic gets a lot of support.
For example, the government provides the supplies, the family planning methods, and we also have NGOs that volunteer to do family planning. For example, the surgical methods of family planning like tubal ligation, vasectomy.
Kenya's health ministry has said increasing access to family planning resources is key to meeting the country's development goals in the coming decades. Alex Basire, an obstetrician gynecologist who has worked in Nairobi the last 8 years, says the strong emphasis on family planning is good for individual patients and the health of the country at large.
You do not want your population as a country to just explode because you will not be able to provide them with jobs. Unemployment will be a big thing. Okay, provision of social amenities and even basic social services would be affected if the population is not controlled, so to speak, by use of the family planning.
Dr. Basire says he has also noticed that women patients are increasingly breaking free of past societal taboos about contraception and are more willing to ask about their options.
Now, with the education that is being rolled out by the government and some of these NGOs out there, there's been a more acceptance to this, and the fact that now there are more and more ladies coming out and saying, hey, I need a contraception.
But despite progress in Kenya, government statistics show nearly 50% of pregnancies in the country are reported to be unplanned, and there's still a long way to go to ensure population growth does not outpace the economy. Gabe Joselow, VOA News, Nairobi.